morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, good morning. Welcome back to Insurance Matchmaking. There's been a lot of stuff popping up online and in the news I've actually seen, and it was like a Fox local, in the headline stated that Part D is going away, or government's ending Part D. No, that's not what's happening. So always remind everybody that, if you get the sky is falling reports, double check with your agent, and even if I'm not your agent, if you did go to one of those 800 numbers or something and got something, or somebody signed you up 5 years ago and you haven't heard from them in 5 years, you don't know if they're even still in the business, sure, give me a call. I can answer some of those questions. But, just like yesterday, I had a client call me, and, we keep getting these phone calls, and they tell us we can get this card and get they're on a Medicare Supplement. And it's like, yeah, you have to go for you have to go for a Medicare Advantage to get one of those cards, like the food cards, and it's only on certain plans, but it's a nice little come on to get people to go, oh, there's a benefit I'm missing out on. I should call that 800 number and find out about it. You're just calling a high-pressure sales call center when you call those. They're not, they may advertise themselves as Medicare assistance or senior benefits guidance. No, they are for-profit, and that person on the other end of the phone's entire job is to get you on a Medicare Advantage, whether you're on one or not. And it's not to leave you on, and if you are on one, it's not to leave you on the one you're on. And I'm sorry, I got a little sidetracked. That wasn't what I was going to talk about today, but it still kind of fits. Get a local agent. And you've heard me, if you listen here very often, you've heard me say, even if it's not me, talk to somebody local. I mean, I work out of state too, because it's a competitive business. We need constant flow of clients to keep the lights on. But so you could talk to somebody out of state and get good help. I mean, there are groups out there. I work with some of them. They work across all the states. But if you can, especially most people like to sit down with an agent and go over everything. And for us, it's not as efficient in the appointment time. We usually end up taking longer, and it's easier to get into side conversations versus if you're on the phone, you want to get it done and get off the phone. And I think that works for both sides. So those are a little more efficient, but they're not as personal. So, but local agents, we know the local market. And so if you can find a good local agent, find them and stick with them, and they're going to let you know when things change. Just like I was in conversation with another client, their Medicare Supplement rate is going up considerably in September, and so I double-checked and found a solution where I maybe can save them about $300 a year. So, that's a substantial savings, and so we'll see how that goes. But those are some of those benefits of working with somebody local. But there's a lot of stuff going on with the Medicare Part D. That is the prescription drug coverage. If you've heard, again, I always do this in my in-person workshops and say, there's a lot of letters. You got A, B, C, and D for Medicare, and in your Medicare supplements, they're also designated by a letter. So it gets a little confusing because there's a lot of letters flying around there, and they don't make a lot of sense. Why is this A and B? Why is this C? Why is this D? But D actually makes sense. D is the drug coverage. And it's like, and that makes sense, but I always say, but it was the government that did it, so they probably didn't do it on purpose. But so the Part D is your prescription drug coverage. And what kind of getting into today is there has been a lot of discussion about, the Trump administration, CMS, whoever you want to blame, is taking away Part D, or they're taking, Well, what happened was back in 2022, during the Biden administration, they passed the Inflation Reduction Act. And what that did was that changed the way a lot of things happened with the Part D prescription drug coverage. One of those was it actually put a true maximum out of pocket on that Part D. So The first change was, if you're familiar with the donut hole, or maybe you've heard of it, I've always hated the term. It was a gap in the Part D coverage, and what happened was, after you had the certain costs of your prescriptions, not what you had spent, but what the actual costs had been for those prescriptions, when you hit that threshold, you went into a coverage gap where now you were paying 25% for all your prescriptions. So that gave the insurance companies a little bit of a cushion of paying for your prescriptions. And then you hit another threshold, and it was combined with, what you've spent for the prescriptions, what the insurance company has spent, what manufacturers had contributed as discounts to the program, and it was called a troop. And it's a very not quite correct statement, but the definition was there. And troop stood for true out of pocket, but it was anything but. It was not the same for everybody. It did typically, most people at that time, if they hit that troop threshold, they generally had about $3,500 out of pocket for their prescription costs to get to that point. That was not the end, and that's why I'm saying it was not a true out of pocket, because there was a lot of formulas that came into place to coming up with the number, and even after you hit that number, that just puts you into what they called the catastrophic phase, and you paid 5% for your prescriptions from there. The Inflation Reduction Act, the first thing it did, the major change that affected the members, was they no longer had that 5% surcharge once they hit the catastrophic phase. So that was the first year that there was a definite financial difference for the people on the plans. The next year, there was a true max out of pocket for the prescriptions, and that was $2,000. And that was, I believe, was 2024 is when that first happened. So then, or actually, no, that was in 25. But the other thing that happened there was costs of the prescriptions, once you hit that catastrophic phase, shifted a whole bunch more onto the insurance companies. And they're now paying 60% of the cost of those prescriptions. So that took a big chunk out of their profits. And that's why a lot of the companies, they just decided they weren't going to pay us commissions anymore to help people with their Part D plans. A lot of companies just got out of the business altogether, which, again, now there's less competition providing Part D coverage. So there's a lot of more costs that are affecting people. The other thing is just that 2,000 max out of pocket, that didn't stay there. This year in 2026, that went to 2,100. Next year in 2027, that max out of pocket will be $2,400 on the Part D. And it's not all your prescriptions. That number only applies to prescriptions that your drug plan covers. So that's one of the reasons why we always say, hey, when it's come time for re-enrollment, we really need to evaluate that. Now, and that's one of the things that's frustrating for us. We used to get paid a little bit for whatever drug plan you had. If you were brand new to Medicare, same thing with the Medicare Advantage plans. We get basically, it's kind of like we get 2 years commission on the first year, and then we get renewal commissions going forward. If we switch somebody's plan from another plan, we get the renewal rate as the commission for that year. So at least we got a little something that kind of helped compensate us for our time. And it was also, and it still is a source of potential new clients that might buy other plans from us. But we don't want to spend our whole enrollment season, because it's a very busy time, just doing Part D drug reviews, because if that's all we're doing, we're not making any money. Right now there's only like one company that's paying commissions on their Part D, and who knows that that's going to be true in 2027. We won't know till closer to October. And I say closer to October, some of these companies have given us surprises in November and December saying, oh, by the way, if you put anybody on this plan, we won't pay you for that next year, after we've already enrolled people in some of those plans or had done some reviews and we're getting back the next week. And then it's like, well, if you write it after this date, we're not going to pay. We're going to do what's right. I mean, I say we as in my office, we're going to do what's right for you. But some people are only going to put you on a plan that's going to pay them a commission, or they're not going to help you at all. I mean, that's some of the I've heard some agents just say, "Oh, we don't do Part D. They don't pay us for it." You can call the company or go to Medicare.gov yourself. Now, I have directed people to Medicare.gov to enroll themselves. I've actually put together a little PowerPoint that walks you through the process. It really is not that difficult. I mean, if you can do email or you know how to do Facebook, you can go to Medicare.gov and sign up for your prescription drug plan. Now, I don't necessarily recommend you just go there and just sign up without any coordination, but it does make sense to, and if you have a lot of prescriptions, shop those prescriptions. Don't go for the lowest cost plan just because it's the lowest price. If you don't take any prescriptions, yes, by all means, and don't go on Medicare and not sign up for Part D, because I'm going to get into the bit about the penalties on that here in a bit, and that's one of the things I want to make sure you're aware of, and I'm going to kind of explain how that charges. But I mentioned that the $2,100 max on the prescriptions is going to be $2,400 in 2027. Currently, we have a $615 deductible allowed on Part D plans. Most of the plans, that's the deductible they use, but they don't. But they can't charge more than that for the deductible, but most do. But most of the plans that do that, it doesn't apply to the Tier 1 and 2 generics. It's just Tier 3 and higher, the more expensive prescriptions. Anybody who has Eliquis or just went blank on some of the Eliquis, Xarelto, anything you see advertised on TV that are those brand name drugs, you're going to pay through the nose to get those prescriptions filled the first time. I get calls all the time in January and February. Hey, I was only paying $45 for my prescription and now they're charging me $400. Why? It's a new year. You haven't met the deductible on that. And maybe last year maybe they were on a plan that didn't have a deductible. Again, some of those things change. We try to make sure everybody's aware of that. But you're going to pay that deductible, and then you're going to pay up to the $2,100. Now, I do recommend if that, you figure you can't fill your prescription because you can't come up with $600, $700 to fill that prescription. All the drug plans, one of the things that came out of the Inflation Reduction Act is that monthly prescription payment plan. You have to be on the plan before you can set that up. So like if you're changing plans, you have to wait until you get your new member material. Then you can call customer service and set up that payment plan. The others, if you're just sticking with the company you have and you're going to have a big deductible in January, you can get that arranged in December. And the beauty of that is you go to the pharmacy and you don't pay anything at the pharmacy. You're going to still pay it, but it's going to be divided over 12 months, that total bill. And then when you go and fill another prescription, they adjust that total, and then they divide it by the remaining months of the year until you hit that $2,100 or $2,400 max out of pocket. That's separate from your monthly premium, and if you still have to pay it. It's basically a no interest loan, but you do have to pay it. It is, and it can reflect on your credit if you don't pay it. So make sure you pay that. So anyway, we're up on the break here, and I'll be right back in a couple minutes.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
Hi, this is David Price with Twin Lakes. Your business depends on staying connected, whether your employees are in the office, on the road, or working in the field. That's why Twin Lakes now offers both gig speed fiber internet and Tri-Lite Mobile for business. Move your business mobile lines to Tri-Lite Mobile and receive $600 toward a new phone or contract buyout on your first line, plus up to $400 toward every additional business line. Fast internet, reliable mobile service, and local support from a company that's been serving the Upper Cumberland for 75 25 years. Call 931-476-2151 or visit twinlakes.net today.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and welcome back to Insurance Matchmaking. Before the break, was talking about how the cost changes have kind of happened with the Part D and what those maxes are going to be. As I mentioned, in 2027, the maximum for your, and again, it's only your covered drugs on that drug plan, is going to be $2,400, and the highest deductible allowed is $700. So that has gone up from $615 to $700. So you got an $85 increase on that. Now, one of the things I was talking about when Inflation Reduction Act was passed back in 2022 during the Biden administration, when it came up to in 25, when those costs were going to shift drastically, or not in 25, I take that back. Well, yeah, the costs were going to change in 25, but they were going to be applied during the 2024 enrollment season. So everybody was going to find out how, all the premiums were going to go up on the drug plans, and the benefits were going to drop a lot from the Medicare Advantage plan, because they also do include that Part D component. And just prior to a major election is not the time the party in office wants to drastically raise costs on everybody's Medicare. So they came up with they called it a demonstration. Basically, the federal government came up with a way to subsidize the costs of the prescriptions to the insurance carrier. It was not like the enhanced subsidies on the Affordable Care Act premiums that affected directly to the consumer. This one was going straight to the companies so they could adjust and figure out what drugs they're going to keep covering, or if they're going to put those on different tiers so they charge a little bit more for them. That gave them some time to do it, but those subsidies went straight to the drug plan providers, not to the consumer. So individually, you didn't really see the difference. But this year, that has not been renewed, because the whole reason that it was presented was going to give the insurance companies a couple of years to kind of figure out how to balance their costs. And that's why a lot of, if you have a Medicare Advantage, you'd notice maybe your dental plan went down $500 a year for your coverage, or maybe they cut back or cut out their over-the-counter benefits. So some of the, and they raised copays on other things like ambulance, emergency room, surgeries. They've raised a lot of those copays to help them cover the drug costs, because the problem is you get a $29,000 drug, and of course you hit your max out of pocket after that $2,000, $2,400, whatever that max out of pocket is going to be. The insurance company's still paying 60% of that cost. Now, of course, they spread that cost over everybody's policy, so it's not like, we're broke now because we had to pay for this one drug. But it evens, they're looking at the big picture. So that's why they've cut a lot of benefits. They've cut a lot of plans that they're not paying us commission on. And generally, especially with the Medicare Advantage plans, if they say they're not going to pay us commission on a certain plan, it's usually because they're going to discontinue that plan the next year. But they don't want any more people on that plan because that plan's costing them more than other plans. So by taking that commission off, it kind of encourages us we're still hopefully going to put you on a plan that's a great plan for you, but that we can still earn a commission on, because, we can't work for free. It's not a volunteer position. It is a business. Yes, you can get free advice from other volunteer organizations, and they don't always have the right answers either. But so one of the things I wanted to go through this cost sheet. As I mentioned, the deductible this year is $615. Next year, that'll be $700. That went up $85, and it's a 14% increase. So that is higher than inflation. The max out of pocket is going from $2,100 to $2,400. Again, that's a 14% increase, but it's a $300 per year increase. Now, this is one of the things, and I'm glad I pulled this up, what they call the base beneficiary premium. It's not an average. It's not arbitrary, but again, the government, they have all these different calculations they go by and come up. So currently this year, the base beneficiary premium is $38.99, and next year it'll be $41.33, which is a 6% increase, which that 6% was actually by the Inflation Reduction Act. It was fixed at that. They couldn't raise it. That couldn't raise more than, but again, it's not, the plans aren't necessarily the ones raising it. It is kind of an average, but it's not a true average. But one of the big things on that number I wanted to make sure, I explained very well is when we talk about the Part D late enrollment penalty, that's the number that's used for that formula. The formula for the Part D late enrollment penalty is 1% times that base beneficiary premium. So if you went a year without having Part D, you're going to be charged 12% of that base beneficiary premium, and it's going to be added to your Part D premium. So even if you have a zero premium drug plan, because there is one out there, or a zero premium Advantage plan with Part D, but you're subject to the late enrollment penalty, you have to pay that premium. So that premium and that doesn't go away. You always have it. Now, there are some exceptions about being able to lose that penalty. One of those is if you do have and this is from Social Security, the Low-Income Subsidy, also referred to as extra help. If you're low income and qualify for that, you will be exempt from that penalty. You're also exempt from that $700 Part D deductible. The max out of pocket still is the same. So you're getting help paying for your prescriptions, but you still could have to come up with that $2,400 in a year total, even though you're saving monthly on the plan, on the prescriptions. But again, one of the things on that is when they figure that actually you're not going to pay that amount out of pocket, because they still credit it like you were paying it. If you weren't having the subsidy, what you would pay. You don't have to pay the deductible, so you are credited with paying the deductible towards that $2,400. So you won't have the full amount out of pocket, but it's still figured in. The other thing is, and I should have written down, but what they call NAMBA, but it's the reimbursement amount. Basically, it's what the insurance company is paid, what CMS pays the insurance company for providing you the Part D coverage. And that went up 24% from $239.27 to $296.05. And I know I'm throwing a bunch of numbers at you, but basically it went up about $60. And that $60 now is going to the drug plans. And that's one of the things that frustrates us as agents. We're putting people on a plan. They are getting paid something for that plan. Hey, they decided to do a zero premium or a $3 a month premium. You could have left it at $10 and still paid us the small commission that they were paying us, and they still would have been ahead. But they wanted to have those very low premiums to attract people to go to their plan. So they still want people on their plans, but that's why I said, but at the late penalty. If you're not taking any prescriptions, currently this year there is a zero premium plan. There's a few others that are less than $5 a month. Get that cheap drug plan. I mean, back when the low plan was like $14, $15, I had people signing up for it just because they knew they didn't want to have a late enrollment penalty later. It was worth it to them to pay a small premium this year to not have that late enrollment penalty later, because if they waited a couple years, it was going to be more what the premium was they were paying. And again, it was not going to go away. We do want to make sure that's there. And that what they call the premium stabilization demo, which is what they were doing with the subsidy back in 24, that is ending. That will not apply to 2027. And so insurance companies are making their changes, and they're not sharing with us just yet. This is the time they should have because we're in August now, all the insurance companies should have put their bids into CMS for approval of their plans. So usually what happens is they get those in June, and in July it'll come back and say, nope, this doesn't, we're not going to, we like what you're doing here, but you can't do this here, or you need to put some more money into this benefit. And so that all gets changed. In fact, I found out that was one of the explanations If you're ever looking at the different plans, you've probably heard me talk about the give back plans. That, of course, those plans are going to have higher copays, higher max out of pocket. But if you're not using those benefits, that Part B give back that pays, $100, $150, $50 towards your Part B premium, reducing that cost, comes in really handy. But there were plans out there that had $1 and $2 Part B give back, and it's like, what's the point? And what it was, they had put in their bid. The insurance company had put in their bid for that plan for the next year. And CMS goes, because they do have to cover, I think it's 70% of what they take in, has to, 75%, something like that, has to be applied to care or to benefits. And again, per capita, not per person. Each person has to get that, but because some people, they're going to spend a lot more than 70% on them. And, because they're paying 100% of the costs after max out of pockets and things like that. But on average, they need to be spending 75% of what they take in on benefits for the members. So the easiest way for them to put that in, instead of figuring, well, let's add $25 to everybody's dental, or that, they just said, oh, we're going to give everybody $1 Part B based on this many people we have on our plans. That brings us down now to 74% instead of being at 76. Brings us up to 76% instead of only 74%. Or what, they just, because that's a straight benefit and it's a measurable benefit because they're applying it to everybody on that plan. So that's why those give backs like that, the really small ones, they're just a cost adjustment. But those bids have gone, they put them in June, they maybe got back and a counter from CMS, and they have to go back and make adjustments and resubmit them. So that's all still going on. Of course, even if I knew, I can't tell you now. I can't tell you till October 1st what the changes are on each individual plan. Now, I covered the deductible and the max out of pocket. Those are assessed by the government. Those aren't plan specific, and we know those numbers. When we get the government numbers, we can give you the government numbers once we know them. But like Part B premium, I probably won't know that until sometime in November. It's really hard. We're doing all the pre-enrollment stuff, and we don't know what Part B is actually going to cost next year. I don't know why we can't get that in October also. But anyway, it looks like I'm about out of time. Remember, keep listening to Insurance Matchmaking right here on Grace 107.7. You also can go to insurancematchmaking.com. It also links to my YouTube channel of the same name that has all my past show recordings. I just got 4 more shows uploaded this week. So, please like and share and subscribe to my channel, and we'll talk to you next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.